Hello, everybody. Welcome to our live stream. We are excited that you are here with us as we continue to support you on your journey towards achieving CNE exam success.
Hello, everybody.
So as we take a look at our content, we are going to be focusing on two topics for this episode. The first one is going to be just taking a look real quick at some recent evidence that we discovered related to the CNE exam success. So what we discovered is that there is research out there, and we always like to take a look at the most recent research to really determine if it's content that we want to lead to or really feed into revisions that we're making for the programs that we bring to you all, or if there's an opportunity for us to add additional program content to the resources that we bring. Looking at the work that was done, which it was quite remarkable, I must add, by the Maryland Health Services Cost Review Commission, they were on a mission and continue to be to increase the number of nurse educators that are certified in the state. So who are they? Well, it is a nurse support program, too, that was established in May 2005 to increase Maryland's academic capacity to educate nurses. What we really like about the work that's been done by this amazing organization and really this initiative is that they have invested in nurse educators in the state of Maryland. So we're super impressed that this initiative is happening and that the results look highly favorable, but we do want to dig a little bit into that. So first of all, they focused on increasing certified nurse educators from 2018 to 2021, and the results did show an increase by 92.3%. Okay, that is an excellent return on investment, right? We've got to make sure that we are training the future nurse educators, and getting your certification is a great step in the right direction to be able to do that. And more than 60% of attendees had not attempted the CNE, despite pledging to do so within 6 to 12 months of the workshop. So we wondered, why would nurse educators choose not to sit for the exam, even though their plan initially was to sit for the exam? Well, we know that life happens, and we here at Dr. Sellers Educate are going to support you until you cross that finish line, until you are successful. So what were the barriers? What did the research show? We were not surprised to see that there was limited attendance and few faculty that earned the CNE credential. Based on the research that they published, these were some of the reasons. First, the expense of the exam. The exam is really expensive. That's why our goal is to put you in a position where you have the resources you need that are going to help you close those knowledge gaps based on the NLN competencies for the CNE novice, and the CNE-CL, and also give you support along the way. So to no surprise, these were some of the challenges that were mentioned in the literature that was published based on the work that was done, again, by this great organization. So what do we learn from the information? Well, first, we do offer a workshop. We offer our CNE and CNE-CL live review periodically, monthly for the CNE. And this information is also going to help you on the CNE novice. So these were some of the benefits. It's comprehensive content that we offer. That too was determined to be a contributing factor. So you want to make sure that you are enrolling in a comprehensive program that is going to give you the information you need to close those knowledge gaps, okay? And then the second benefit of a workshop is that it's going to reduce anxiety. We know that taking any certification exam is very nerve-wracking, and we want to help you reduce that anxiety. And that's why we are going to present some content today to help you do exactly that. And then third, it's going to increase your confidence. And we would add even competence when it comes to sitting for the certification exam. Our success framework that was developed based on research that was done on nurse educators is that there are three components to success. First is having at least 3 years of nurse educator experience. The second is having the resources. So Billings and Halstead CNE Review Book, you want the most recent editions right now. It is the second edition for CNE Review Book by Dr. Caputi, and Billings and Halstead Teaching and Nursing is in its 6th edition right now. Okay, so you want to have the most current resources. And then the third component of our success framework is support. You want to have coaches either with us here at Dr. Sellers Educate. We provide that service, as many of you know, and take advantage of the free resources. Okay, we offer a 15-minute complimentary session, or you can choose, if you're ready to move forward, to register for a 1-hour session. Okay, so we'll put that information down in the description for this episode. And also, if you're listening to this on our podcast, we will include that information as well. So you also can be a part of group coaching. So we do meet every single month, and it's a small group. We like to keep it small, and we focus on content to help you, again, close those knowledge gaps. Okay, so it's more of an accountability partner. All right, so that's the major content for that part of this YouTube episode and this edition that we are focusing on. Okay, so the next component is going to be those top 10 exam tips. All right, so are you ready? This is based on feedback that we have heard from nurse educators and our own personal experience as well. We are not endorsed by NLN, and we maintain the integrity of the exam. We do not ask our nurse educators about the specific questions on the exam. We simply ask them one question, and that is, did you feel prepared? Did Dr. Sellers Educate help prepare you for the exam? And the answer that we have consistently received is absolutely an astounding yes. Okay, so that makes us happy. So these are top 10 tips that they shared with us. First, we heard feedback. We want to remind you all that we do have our free webinar on tomorrow. That is September 26th. At 5 p.m., we're going to put that information in our description as well. So hopefully you're catching this episode before that date. Okay, so remember to subscribe to this channel if you haven't already. So every single time there's a new episode, you'll be notified right away. On our podcast, there is also information that's going to take you over to our YouTube episode. If you want to subscribe there, you can always listen to the audio component on YouTube. All right, you don't have to watch the video. So hearing from two of our successful nurse educators that did enroll in our CNE in 60 days, June 2022 cohort, this is what they shared with us. So first, we had a nurse educator that says, I took the CNE exam last Friday, 8/26, and passed. Thank you so much for helping me get organized and recommending such great resources. Our second testimonial says, I want you all to be some of the first to know that I took my CNE today and I passed. I am a first-time taker, and I am over the moon that I passed. I want to thank Dr. Sellers for all her excellent advice, knowledge, and support. I could not have done it without Dr. Sellers and the support of the group. The test went well. I took it at a testing center, and it went well. It took me 2 hours and 45 minutes. I cried when I submitted my test, and it said I passed. We have 17 Google reviews, and you can see our star rating is 4.9. So we have a mission here at Dr. Sellers Educate, in case you're not aware, that we want to support every single nurse educator to get certified by NLN. We know that certification is the mark of professionalism, and we want to support you on your journey. One of the steps we take every week or so is by posting a new episode. Okay, so it's going to allow you to stay current and updated with fresh content to close your knowledge gaps. This is our 7-week study plan that is a part of our study workbook. That is available also in the description. If you don't have your copy yet, we highly encourage you to get that right away. All right, so looking at the content, tip number 1, self-assessment. You've got to know where you are, right, on this journey. We know that the ultimate destination is for you to achieve certification, but it doesn't stop there. We want you to come back right here at Dr. Sellers Educate to stay updated about content that we're going to be releasing about next steps you should take to get ready for your renewal. Okay, so we're going to be featuring that as part of our YouTube snapshots as well. So the self-assessment, you have 3 options. There's the detailed exam blueprint that is in your candidate handbook. The NLN Candidate Handbook is available on the nln.org website. Grab that free resource right away if you don't have it already. The second option is exam analysis. We have 2 exam analysis assessments. We have what we call the basic assessment, and then there's the advanced version. We just created the advanced version based on feedback from you all that wanted to do a deeper assessment of content related to some of those advanced terms. So we talk about those specific components in a boot camp previously that was recorded. So make sure you go to our website and join our boot camp community. It is $7 and you can cancel it anytime. And here's a special treat. You get to review previous episodes as well. And then the SAE, that is a self-assessment exam that is published by NLN. Again, we're not affiliated with NLN, but we wholeheartedly believe in their mission. It's aligned with ours, which is to help nurse educators get certified. All right, so SAE, self-assessment exam, is another option. Tip number 2, Bloom's Taxonomy. Yes, there is still quite a bit of content on Bloom's Taxonomy. So you want to make sure you understand the verbs for each level, the objectives associated with each level. So you want to go ahead and practice, okay? Practice writing out some of those objectives that are going to include the verbs for each of those levels on the Bloom's Taxonomy. If all of this sounds a little foreign to you, take a look in Billings and Halstead. That's where you're going to see a lot of great resources. And it starts on page 188. All right, so you want to make sure you go there and check out the content there. All right, so another component while we're talking about Bloom's Taxonomy that I just want to mention is that there are 3 different types of learning domains. All of them have their own taxonomy. We talk a lot about cognitive domain because in nursing, we've got to be competent, right? So we always start there, but there's psychomotor and affective learning domain as well. And again, they each have their own taxonomy or pyramid associated with the different levels of learning. And assignments. So you've got to understand what are some of those specific assignments that are going to evaluate learning for our students in our classroom at each level and for each of the different types of learning domain. We focus a lot on psychomotor, right? Because in nursing, it's all about clinical application. But for the NLN CNE exam and CNECL, you got to make sure that you understand other ways that we can evaluate our students under the affective and psychomotor domain. All right, I'm wrapping up. Tip number 3, learner facilitation. You got to know some examples of those engaging teaching strategies. If they're not familiar to you, let me just flip over Billings and Halstead, and I'll give you a reference to help you close those knowledge gaps. All right, so it's going to be table 14.1. What we really like about this table, and it's on page 249, is that it lists out the learning theory, and we know you got to know those too, right? But it also gives you some specific tenets associated with that learning theory. And then lastly, practical uses or teaching strategies. Okay, so make sure that you head over to, again, table 14.1 in Billings and Halstead in the 6th edition on page 249. Tip number 4. You have 3 hours to take the exam. There are 150 questions, so you want to pace yourself. Tip number 5, you've got to understand the learning environment. How do we as educators take additional steps to engage in creating a civil, safe learning environment? Tip number 6, learner diversity. It's important that we understand our students' needs and be able to create a learning environment where they are able to focus and have the resources they need. Sounds complex, right? So what is our responsibility in making all of that happen? We know that there have been socioeconomic challenges that have plagued our students. So how do we as educators have the knowledge we need to have about learner diversity in the classroom? We just covered that during our boot camp today, actually on September 25th. So I encourage you, if you haven't already, join our community, okay? It's the best way right now to help you stay focused on content to help you close those knowledge gaps. So if you're not familiar with the strategies that you can use to encourage learner diversity and create that inclusive learning environment, head over to our community, and I'll put that link also in our description so you'll be able to access that content right away and help you close your knowledge gaps. Tip number 7. All right, we're almost there. Curriculum. What is the process associated with the revisions of the curriculum and of our nursing program? Why would we make changes? Okay, what is the data, both qualitative and quantitative, that's going to lead to you making that decision? Evidence-based strategies as well. Tip number 8 is program development. What are the steps you're going to take to engage the faculty in the process? Tip number 9, narrow it down to 2. It is very common for nurse educators to get down to 2 good answers on the CNE exam. So how do you pick the one right answer? Well, one strategy you should use is following that study plan. When you sit for the exam, you're going to pull from one of two places, either your personal experience as an educator or the content that you've reviewed during your 7-week study plan to help you close those knowledge gaps. Our final tip is the study plan and being able to focus. Okay, this is feedback that, again, we've heard from nurse educators just like you that are sitting in the seat and trying to decide when they are going to schedule the exam. Our strongest message is do not wait. Okay, make 2022 a priority year to invest in yourself, to look at our study workbook, close your knowledge gaps, schedule that dedicated time for you to study, and close your gaps in all of the 8 competencies, or with CNECL, there's 6 competencies, and be able to focus. Okay, so these are our top 10 tips to help you be successful on the CNE exam. Remember that competency 1 and 2 cover 37% of the exam, okay? And competency 4, curriculum development, is a huge part as well. The time is now, okay? This is your time to invest in yourself and close your knowledge gaps. Sharina Samuel was kind enough to post on our Google business page. Go ahead and head over there, Dr. Sellers Educate Google business site, and you'll be able to find it. But she shared with us that she passed the CNE exam with the help of Dr. Sellers. I completed the 4-hour virtual live prep review session and purchased all the suggested resources, including the practice self-assessment exam to identify gap areas. During the session, I followed along with her study guide. After the session, I used her suggested study plan. The exam does not have a high success rate, but I felt confident going into the exam that I was well prepared and confident. She was available for questions and responded in a timely manner. If you're looking to take the CNE exam or have been putting it off, Dr. Sellers Educate can help. Thank you. Well, we thank Sharina and we thank all of you for giving us an opportunity to help you be successful on your journey. Stay focused, and until next time, we will see you right here on Dr. Sellers Educate. Have a great day, everybody. Bye-bye.